my name is Erica Morris. I'm a student physical therapist assistant with Jeff State, and today I have Adriana helping me. Thank you, Adriana. Okay, today my case is on a patient with tennis elbow, which is also known as lateral epicondylitis. Lateral epicondylitis is inflammation of the lateral epicondyles, and it's frequent and common in tennis players. Adriana here is an avid tennis player. She is also an engineer, which requires a lot of writing and drawing. Is that true?
Yes.
Definitely. Okay, so these symptoms appeared after a 4-day tennis tournament, which is no surprise. So what we're going to do today is we're going to work a little bit with her and loosen some of those fibers up and hopefully start creating a healing environment for those lateral epicondyles and those sensors. Okay, so we know that she is right-hand dominant, and two subjective findings we have found is a constant dull ache outside the elbow. That would be in this area right here, which is where the wrist extenders attach in the lateral epicondyles. Also, she has pain with writing and drawing more than 30 minutes. Two objective findings is with a manual muscle test on the right wrist extenders, there's a 4 out of 5 with increased symptoms of pain. Also, it's warm and tender to the palpation of touch, which would suggest inflammation in that area. Okay, so today I'm going to demonstrate to you a soft tissue mobilization, and this is a longitudinal technique. Now have your arm, please. It's the right arm. We'll start here and just kind of warm these wrist extenders up some. You go gently, just increase blood flow to this area. The reason I'm doing this is to relax these tense muscles, because when they're in pain, they're going to become real tense. When we relax them, it's going to create a healing environment in this area, which is going to stimulate blood flow and bring new nutrients to the area. Also, it's going to help stretch it out a little bit, which is also going to facilitate healing. Again, two findings because of this is a dull ache and warm and tender to the palpation in this area. Okay, once we've done this, we will do it for about 15-20 minutes in this area. She should feel quite a difference in her wrist extensors. They should not be as painful, and they should not bring any increase in pain at all. Also, she states that rubbing it is an easing factor, so this should definitely help her feel better as well right now, but more importantly, create healing for this area. Okay, thank you. So Adriana, there's some things I'd like for you to keep in mind today, some education things, is that I understand that you write and draw quite a bit with your work, correct?
Yes.
Okay, so we cannot change that. It's very important, and you cannot change your occupation, obviously. We wouldn't want you to. So what we're going to do is what I like to do is modify that a little bit.
Okay.
What I like you to do is every 10 minutes, I want you to take a break for about 2 or 3 minutes. And what you're going to do is you're going to put your pencil down, you're step away from the computer or wherever you're at, and I want you to just rest those arms in neutral for me, okay? Don't move them, don't pull them back, just rest them. And the reason for this is that when you keep them extended for a long period of time, you're pulling them back and you're actually facilitating these wrist extensors. You're using them, okay? And they're tired. They need to rest for a little while, okay? So just let them rest. Okay, and after about 2 or 3 minutes, you can pick up and start using them again, okay? Then do it for another 2 minutes. But I do not want you to use your wrist extenders or write or draw for more than 10 minutes at one time, okay, without taking a break.
Okay.
Also, if you feel yourself start getting a little sore and tender there, go ahead and take a break, okay? What that break's going to do, taking those frequent breaks is going to allow for healing to occur in that area. Because keeping them extended aggravates them, okay? And the longer you keep them extended, the more it aggravates those extensors, okay? So keeping them still is going to help healing to occur in that area, okay? And that, with a combination of the other things we're doing here in therapy, is hopefully going to bring a lot of pain relief, and more importantly, it's just going to facilitate healing in that area, okay? Okay. So, a home exercise, and I'm definitely going to send you home with this sheet, so don't feel overwhelmed when I'm telling you about this, okay? I just want you to demonstrate, and I'll make sure that you can do this correctly, okay? Okay, this is called a self-stretch for your wrist extensors, okay? So what I like for you to do is go ahead and put your arms straight out, Do not put it above or below.
Okay.
Okay? What I like for you to do is lock that elbow in place. Okay? Make sure your shoulder's next to you. Take your arm, point your finger straight down to the ground.
Okay.
Pull back. Good. Just that easy. What's going to happen is you're going to hold that for 10 seconds. Okay? I'll leave that for a few seconds. I won't make you hold it 10 seconds today. So pretend that's 10 seconds. Go ahead and put your arm down and let it rest for 20 seconds.
Okay.
Okay? You're going to do that 3 times.
Okay.
Okay? Then you're going to turn around and do it 3 more times that night. So you're going to do it twice a day. Each time you do it 3 times.
Okay.
But again, don't feel overwhelmed. I'll send you home with a sheet, okay?
Okay.
Some precautions you want to take. Really important here.
Okay.
You feel a dull pain, ache, or sharp shooting pain that's even worse than the normal pain you've had, stop.
Okay.
Okay? And do not continue until you've come back to see us, okay?
Okay.
If the pain continues even after you stop, go ahead and call your MD. Don't worry, don't take a big alarm to what I'm telling you because that normally does not happen, okay? Just want you to take those precautions and be aware and just take it back in your mind for future reference, okay? Just in case you need it. Also, I don't want you bending this arm out. I don't want you bending it down because if you're in a little bit of pain, you might have a tendency to do that and not think. Well, you're not really facilitating those muscles if you move your arm. It's important to keep it locked out for me, okay? Okay? Do you have any questions about that at all? Okay. So the prognosis that we have for Adriana is that she should be able to return to a normal level of function in approximately 4 to 6 weeks if she continues therapy twice a week like she's been coming. By the significant amount of progress that was made at the reeval, the patient should not need a counterforce brace with normal day-to-day activities. But she needs to be able to remember to take frequent rest breaks and be careful not to overload the humeral ulnar joint. So Adriana, if you decide to work in your ride and draw more than 30 or 45 minutes, we're going to send you home with a brace. And I want you to go ahead and put that brace on, okay?
Okay.
If you are in another tennis tournament, it would probably be a great idea to wear the brace then. Because what tends to happen is once a patient is diagnosed and has problems with their lateral epicondyles or have tennis elbow, they're more than likely to have it again throughout their life. And we don't want that to occur for you. So the best method at this point would be prevention after we heal this episode of it.
Okay.
Okay?
Yeah.
Okay. Well, do you have any questions?
I do not.
Okay, thanks for coming in.
Thank you.